Hey everyone, and welcome back to our channel. Today we're going to be discussing an important topic: how Medicare works with other forms of insurance. As we all know, Medicare is a federal health insurance program for people who are 65 or older, people with certain disabilities, and people with end-stage renal disease. But many people also have private health insurance or Medicaid, and it can be a bit confusing to understand how these different forms of coverage interact. First, let's define what Medicare is. Medicare is divided into four parts: Part A, Part B, Part C, Part D. Part A covers hospital stays, Part B covers doctor visits and other medical services, Part C is an alternative to the original Medicare, and Part D covers prescription drugs. So if you're enrolled in Medicare, it is important to understand what each part covers. Now let's talk about how Medicare works with private health insurance. Many people have private health insurance through their employer or their spouse's employer. The insurance that pays first is called the primary payer and will pay up to the limits of its coverage. The one that pays second is called the secondary payer and will pay what the primary insurer didn't cover. It's important to remember that the secondary payer may not pay all the remaining costs. If you have private insurance like group insurance from your employer, it will usually become your primary coverage once you are enrolled in Medicare. This is if your employer has 20 or more employees. If your employer has less than 20 employees, Medicare will pay first. This means that your private insurance will pay for your medical expenses first, and Medicare will pay for any expenses that your private insurance does not cover. It's important to note that if your employer's insurance is an HMO or a PPO that pays first and you go out of network, it's possible that neither the plan or Medicare will pay. Make sure to call your plan to find out if it will cover the service. If you've dropped your employer-offered coverage, Medicare will pay first unless your spouse's insurance covers you and their employer has at least 20 employees. If you're under 65, disabled, retired, and you have group health coverage through a family member's group health plan, their employer must have at least 100 employees for the plan to pay first. If they don't, Medicare will pay first. But what happens if you also have Medicaid? Medicaid is a state-administered program that provides health coverage for low-income individuals. Medicaid will pay for any deductibles, co-payments, or co-insurance that Medicare does not cover. This is known as a Medicare Savings Program, and you may be eligible if your income is low. It's important to note that if you have both Medicare and Medicaid, you will typically have no out-of-pocket costs for most of your health care services. In addition to private insurance and Medicaid, you may also have additional coverage such as Medigap policy or a Medicare Advantage plan. A Medigap policy is a private insurance policy that supplements original Medicare and can help you pay for out-of-pocket expenses such as deductibles and copays. Medicare Advantage Plan, also known as Part C, is an alternative to original Medicare, and it is offered by private insurance companies that contract with Medicare. It typically offers additional benefits such as dental and vision coverage. It's important to review your insurance options and to carefully consider how they will work with your Medicare coverage. You can change your coverage during certain enrollment periods, and it is important to review your options each year. If you have any questions or need assistance, you can contact the Benefits Coordination and Recovery Center at 1-855-798-2627 or visit Medicare's website at medicare.gov. Remember, the key is to stay informed and understand your options. That's it for today's video. We hope you found it informative. If you have any questions or topic suggestions, please let us know in the comments below or call this number. Don't forget to like and subscribe for more videos like this. Thanks for watching.